Welcome back in. You know this can be serious if you've ever gone through this, but back and neck pain can be a real pain in the, well, neck. No pun intended. Of course there is. So to help you feel a little bit better, we have orthopedist Dr. Hussein Aziz joining us today virtually. How you doing, Doc?
Hey, I'm good. Thanks, Sheldon. How are you doing?
I'm doing fantastic. So what are some of the causes of back or neck pain?
Yeah. Well, as you covered very well, Sheldon, back and neck pain is something that has plagued almost pretty much everyone in the U.S. There's two main causes. The first one is what we call mechanical back pain. Now, mechanical back pain comes from the structures of the spine. In between the bones of the vertebrae, there are what we call discs, which act like the shock absorbers of the spine. When those degenerate, they can certainly cause pain. And also there's joints in the spine. Just like you have a knee joint, a hip joint, or joints in your fingers, you have joints in the spine. And when those develop arthritis, that can be painful as well. And lastly, the soft tissue and ligaments of the spine with time are prone to aging and getting degenerated. And all of those features can contribute to mechanical back pain. The second category is coming from compression of the nerves or the spinal cord itself. And that will present as shooting pain from the neck down into the hands, or shooting pain from the lower back down into the buttocks and legs. And that would be nerve compression kind of pain. And those are the two most common categories.
Yeah, and there's a difference between soreness and a sharp shooting pain. So when you're feeling those that don't feel typical, when should you go see a doctor, and what type of doctor should you see?
Yeah, that's a great question, Sheldon. So there's a few different doctors that you can see. A lot of primary care doctors, family docs are qualified and happy to treat some back pain. A physician called a physiatrist can also treat back pain. A pain management doctor or a spine surgeon such as myself will treat back pain. There's many different treatments and many different indications to go see a doc, but when it starts to get in the way of your activities of daily living, let's say you're having trouble cooking breakfast, vacuuming the floor, having trouble falling asleep at night, and it's just getting to be miserable, that's the point when it's time to go see your doctor for a consultation.
All right, what kind of treatments are out there that you think people need to have?
There's a lot of different treatments, Sheldon. Some work and some don't. Let's talk about the ones that work. So on the conservative end of the spectrum, the less invasive, more safe treatments, the mainstays are weight loss, exercise, and it doesn't have to be anything super intense, like going mountain biking 24/7. It can be a brisk walk, getting in the pool for some swimming, going for a light hike with some friends, just some sort of regular physical activity to help with conditioning. And that can be combined with an anti-inflammatory medication over the counter, such as ibuprofen, Advil, any of those medications. If that's still not doing it, if that's still not taking care of the neck or back pain, the next step would be an injection. Now, either the nerves of the spine can be injected, or the joints of the spine, or the areas surrounding the spinal cord can be injected, and that often brings relief. These two methods of treatment can cure up to 75 to 90%. For that remaining portion that patients aren't getting relief for, that's when it'd be time to go see a spine surgeon to talk about other options.
All right, thank you so much. We've hit just the tip of the iceberg with Dr. Hussein Aziz, an orthopedist, but we certainly appreciate your time today, and we'll talk to you soon, okay?
Thanks for having me, Sheldon. I appreciate it.
All right, thank you now.